Welcome back to TV5 News at 9. It's time now for Medical Moments with Covenant Healthcare. Joining us this morning is Katie Parkhurst. She is a registered nurse and manager with the Covenant Visiting Nurse Association. Thank you so much for being here. How are you today, Katie?
I'm wonderful. Thank you for having me.
Of course, we're so glad you're here. Thank you so much for being here. So, Katie, Covenant Healthcare offers home health care services. To get us started, can you explain a little bit about what types of services Covenant Visiting Nurse Association offers?
Definitely. Covenant VNA offers a wide variety of services from skilled home care, which includes therapy services, skilled nursing, home health aides. We also offer home infusion services for antibiotic therapy, nutrition therapy like tube feeding or TPN, as well as specialty infusions from a specialist. We also have home medical equipment for all of your DME or medical needs, oxygen, wheelchairs, hospital beds, those types of things. And we also have hospice services for end-of-life care. One of our newest programs is our home-based palliative care program, which is just newly started. So lots of exciting things at the VNA.
Explain to us the difference between that hospice and palliative care.
Yeah, hospice is focused, truthfully, they're both focused on comfort care and making sure patients have quality of life. The biggest difference is hospice is for a patient who's no longer seeking aggressive treatment and is just focusing on the symptoms and wanting to be at home until the end of their life. Palliative care focuses around the overall wellness of an individual at any stage in their disease process, whether that's an absolute new diagnosis that they haven't even begun treatment for, someone who's just living with a chronic illness and have been for a while, or maybe someone who is still fighting that terminal illness but isn't quite ready to stop treatment. We can really help at any stage. Palliative care is an interdisciplinary approach similar to hospice. We at the VNA have a nurse practitioner, Elizabeth Fulton, who is joined our team and sees patients in their home or wherever they call home to support them and go through their symptoms and what is needed to make them comfortable while they're undergoing those treatments. So it's really a patient-centered plan.
So, Katie, tell us about some of those misconceptions about these services that people have.
Definitely. I think one of the biggest misconceptions is that palliative care is hospice care, and that is definitely not the case. There are patients that will transition from palliative care to hospice, but not all patients are at end of life when seeking palliative care. Like I said before, it can be at any stage in their illness, maybe at the beginning of their illness where they're still seeking chemotherapy or dialysis, all of those curative measures. But I think that would probably be the biggest misconception that people have.
Okay, thank you for clearing that up. You know what, Katie, every nurse that I've ever met, they're such a special person. They have such compassion and are so caring. So why do the nurses that you work with do what they do? I know they're passionate about what they do.
I think, as you said, nurses in general have a passion for people and a passion to help. And for me personally, getting invited into someone's home and being able to walk that journey with them, regardless if it's a new diagnosis, someone's making a change and needing to wear oxygen or use a wheelchair, whatever that is, it's a privilege and an honor to be a part of that and to help them walk through it. So I would say for the people we work with here at the VNA, it's a sense of family, whether that's our own team or the patient and their family.
Well, we are so lucky to have you and all of your nurses in our backyard. Katie, if someone's interested in home medical equipment, home health care, or hospice services, how can they contact Covenant Visiting Nurse Association?
Definitely. You can always visit our website, Covenant Healthcare, or call the Visiting Nurse Association phone number and ask any one of the team members any questions you have, and we can set up meetings or answer your questions over the phone. We just want to make sure the patient's needs are met.
Oh, such great information. Anything else that you'd like the community to know, Katie?
I think the biggest thing is just don't wait to ask a question. If you ever wonder anything about a loved one's care or your own care, give us a call. You know, we'd be happy to try to find some support for you regardless of what it is.
Well, we can tell, Katie, that you are passionate about what you do and you have such a nurturing spirit. We are lucky to have you. Thank you for calling in today. We appreciate it.
Thank you so much. Have a good day.
You as well, Katie. Thank you. And thank you again for being with us today. If you'd like any additional information on today's topic, just head on over to the hot links page on WNEM.com.